58-year-old man with a history of hypertension, type 2 diabetes, and coronary artery disease presents to the emergency department with severe shortness of breath, confusion, and chest discomfort for the past 3 hours. Vital signs: BP 7850 mmHg, HR 115 BPM, RR 26 breaths min, oxygen sat 88% on 2L nasal cannula. On physical examination, the patient appears cold, clammy, and lethargic. Jugular venous distension, JVD, is present. Babacillar crackles on lung auscultation. A faint S3 gallop is heard on cardiac auscultation. Extremities are cold with weak pulses. Pulmonary artery catheterization shows cardiac output, CO, pulmonary capillary wedge pressure, PCWP, systemic vascular resistance, SVR. Which of the following is the best initial treatment for this patient's condition? A. IV furosemide, B. For dobutamine. C. Avoid fluids. D. IV beta blockers, E. Nitroglycerin. Answer and explanation. Correct answer, B. IV dobutamine. This patient has cardiogenic shock due to left ventricular LV dysfunction, likely from acute heart failure due to myocardial infarction or decompensated systolic heart failure. Cardiogenic shock is characterized by cardiac output, CO, hypotension and poor perfusion, cold extremities, altered mental status. PCWP, left heart filling pressure, pulmonary congestion, crackles, dyspnea, hypoxia. SVR, compensatory vasoconstriction, cold, clammy skin. Dobutamine, a BA1 agonist, is the best initial treatment because it increases cardiac contractility, reduces pulmonary congestion by improving forward flow, maintains adequate organ perfusion. If hypotension is severe, a vasopressor like norepinephrine may be added for blood pressure support. Why not the other options? A. IV furosemide worsens hypotension by reducing preload in a patient who already has poor cardiac output. IV fluids, contraindicated in cardiogenic shock as it exacerbates pulmonary edema by increasing PCWP. D. IV beta blockers, avoid in acute decompensated heart failure and cardiogenic shock. They worsen contractility. EI4 nitroglycerin causes vasodilation, which further decreases preload and BP, worsening shock. Key takeaways for cardiogenic shock, LV failure type. The CAS CO PCWP SVR equals classic hemodynamic profile. Signs: hypotension, cold extremities, JVD, pulmonary edema. Treatment: Inotropes, dobutamine, milrinone to increase contractility, vasopressors, norepinephrine if needed for BP support. Avoid excessive fluids, diuretics, and vasodilators initially. Would you like another